Hello, I'm Lavanya. Welcome to PeacePal.in. We are here today to learn about depression. Let's embark on a journey to learn about depression on a deeper level. First topic is what is depression? Depressive disorder, also known as depression, is a common mental disorder. It involves a depressed mood or loss of pleasure or interest in activities for long periods of time. Depression is different from regular mood swings, with changes and feelings about everything. It can affect all aspects of life, including relationships with family, friends, and community. It can result from or lead to problems at school and work. Depression can happen to anyone. People who have lived through abuse, severe losses, or other stressful events are more likely to develop depression. Women are more likely to have depression than men. Let's see some facts about depression. An estimated 3.8% of the population experience depression, including 5% of adults, 4% among men, and 6% among women, and 5.7% of adults older than 60 years. Approximately 280 million people in the world have depression. Depression is about 50% more common among women than among men. Worldwide, almost more than 10% of pregnant women and women who have just given birth experience depression. More than 7 lakh people die due to suicide every year. Suicide is the fourth leading cause of death in 15 to 29 years old. What even causes depression? Let's take a look at that. There are several problems that can cause depression. They can range from biological to circumstantial. They are brain chemistry. There can be a chemical imbalance in the parts of the brain that manage mood, thoughts, sleep, appetite, and behavior in people who have depression. Hormone levels. Changes in female hormones estrogen and progesterone during different periods of time, like during the menstrual cycle, postpartum period, perimenopause, or menopause, may all raise to a person causing depression. Family history. You are at a higher risk of developing depression if you have family history of depression or another mood disorders. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Medical conditions. Certain conditions may trusted source put you at higher risk, such as chronic illness, insomnia, chronic pain, Parkinson's disease, stroke, heart attack, and cancer. Substance use. A history of substance or alcohol misuse can affect your risk. Pain. People who feel emotional or chronic physical pain for longer periods of time are significantly more likely trusted source to develop depression. What are the types of depression? The American Psychiatric Association's Diagnostic Statistical Manual of Mental Disorders, 5th edition DSM 5, classifies depressive disorders as the following. First, clinical depression, major depressive disorder. A diagnosis of major depressive disorder means you have felt sad, low, or worthless most days for at least 2 weeks while also having other symptoms such as sleep problems, loss of interest in activities, or change in appetite. This is the most severe form of depression, that one of the most common forms. Second, persistent depressive disorder, PDD. Persistent depressive disorder is mild or moderate depression that lasts for at least 2 years. The symptoms are less severe than major depressive disorder. Healthcare providers used to call PDD dysthymia. Disruptive mood dysregulation disorder, DMDD. DMDD causes chronic intense irritability and frequent anger outbursts in children. Symptoms usually begin at the age of 10. DMDD is commonly seen in children under 10 these age. They have a lot of anger issues, mostly because they are so attracted or so attached to their phones that they don't leave it even for a second. Everything they do is related to their phone. If they're eating food, they're using their phone. If they're sleeping, before that, they're using their phone. So this leads to them having these symptoms develop. Fourth, premenstrual dysphoric disorder. With PMDD, you have premenstrual syndrome (PMS) symptoms along with mood symptoms such as extreme irritability, anxiety, or depression. These symptoms improve within a few days after your period starts, but they can be severe enough to interfere with your life. Fifth, depressive disorder due to another medical condition. Many medical conditions can create changes in your body that cause depression. Examples include hypothyroidism, heart disease, Parkinson's disease, and cancer. If you are able to treat the underlying condition, the depression usually improves as well. There are also specific forms of major depressive disorder, including seasonal affective disorder, seasonal depression. This is a form of major depressive disorder that typically arises during the fall and winter and goes away during the spring and the summer. Prenatal depression and postpartum depression. Prenatal depression is depression that happens during pregnancy. Postpartum depression is depression that develops within 4 weeks of delivering a baby. The DSM refers to these major depressive disorder MDD with peripartum onset. This is normal and the women should not be judged because of this. Atypical depression. Symptoms of this condition, also known as major depressive disorder with atypical features, vary slightly from typical depression. The main difference is a temporary mood improvement in response to positive events, mood reactivity. Other key symptoms include increased appetite and rejection sensitivity. People with bipolar disorder also experience episodes of depression in addition to manic or hypomanic episodes. What are the symptoms of depression? The symptoms of depression can vary slightly depending on the type and can range from mild to severe. In general, symptoms include feeling very sad, hopeless, or worried. Children and adolescents with depression may be irritable rather than sad. Not enjoying things that used to bring joy. Being easily irritated or frustrated. Eating too much or too little, which can result in weight gain or weight loss. That depends on the person. Trouble sleeping, insomnia or sleeping too much, hypersomnia. Having low energy or fatigue. Having a difficult time concentrating, making decisions, or remembering things. Experiencing physical issues like headache, stomachache, or sexual dysfunction. Having thoughts of self harm or suicide. In males, other symptoms of depression in males may include avoiding family and social gatherings, working without a break, having difficulty keeping up with work and family responsibilities, displaying abusive or controlling behavior in relationships. In females, most women experience postpartum depression after giving birth to a baby. Few of the symptoms are frequent or long bouts of crying, feeling unable to make decisions, withdrawing from friends and family, having no interest in the baby or feeling as if they are another person's responsibility, low motivation and lack of interest in activities, difficulty bonding with the baby, feeling unable to care for the baby. In teenagers, physical changes, peer pressure, and other factors can contribute to depression among teenagers. They may experience some of the following symptoms as well: feeling irritable, restlessness such as an inability to sit still, withdrawing from friends and family, that's common among male, female, or even teenagers, difficulty concentrating on schoolwork, feeling distracted, they can't focus, they're using their phones and they're not able to focus on anything, feeling guilty, helpless, or insignificant, and in these cases, they are not even able to ask for help from their parents, friends, or the people they trust. Feeling guilty, insomnia, sleeping too much, a decrease or increase in appetite, avoiding social situations and activities that they used to enjoy prior. Further, in children, symptoms in children may include crying, low energy, clinginess, deficient behavior, vocal outbursts. Younger children may have difficulty expressing how they feel in words. This can make it harder for them to explain their feelings of sadness. Further, let's talk about triggers. Triggers are emotional, psychological, or physical events or circumstances that can cause depression symptoms to appear or return. These are some of the most common triggers: stressful life events, such as loss, family conflicts, and changes in relationships. incomplete recovery after having stopped depression treatment too soon. Medical conditions, especially a medical crisis such as a new diagnosis or a chronic illness such as heart disease or diabetes. Exposure to news, some movies, and other media. Using alcohol or drugs unless the person has a related disorder. Having too little sleep due to late nights. Risk factors. Some people have a higher risk of depression than others. Risk factors include experiencing certain life events such as bereavement, work issues, changes in relationships, financial problems, and medical conditions. Experiencing acute stress, having a lack of successful coping strategies, having a close relative with depression. Using some prescription drugs such as corticosteroids, certain beta blockers, and interferon. Using recreational drugs such as alcohol or amphetamines. Having sustained a head injury, having a neurodegenerative disease such as Alzheimer's or Parkinson's, having had a previous episode of major depression, having a chronic condition such as diabetes, chronic obstructive pulmonary disease, COPD, or cardiovascular disease, living with chronic pain, lacking social support. Diagnosis. If symptoms of depression last 2 weeks or longer within 1 year of giving birth, a person should receive medical attention. This is also crucial for anyone who is having trouble caring for themselves or their baby. The doctor will ask questions about symptoms and medical histories. They may also request blood tests to rule out other causes of depression. Treatment. Depression is treatable, though the treatment may depend on the exact type a person is living with. However, about 30.9% of people do not respond to treatment or respond poorly. About 4 to 10% people achieve remission of their symptoms within 12 months. But depression can come back, so you need to take care of yourselves. Managing symptoms usually involves three components. First, support. This can range from discussing practical solutions and possibly causes to educating family members. Second, psychotherapy, also known as talking therapy. Some options include one-to-one counseling and cognitive behavioral therapy (CBT). Third, drug treatment. A doctor may prescribe antidepressants. Depression treatment. How to help yourself. In addition to the help and support you get from your therapist and or your doctor, there are a few things that you can do on your own that will definitely make you feel better. First, stay physically active. Exercises helps boost your mood and research has shown that it may also help ease depression. Get a good night's sleep. Sleep helps us heal from many health problems, including depression. Getting the right amount of sleep but not too much helps you have more energy. Try to go to sleep and get up at the same time every day. Make your bedroom a comfortable place for sleeping and all other things. Banish TV and use curtains to keep out bright outdoor light. Stay connected. Spending time with supportive friends or family will make you feel better, even if you do not feel like you do. It will help you for sure. It will help you to choose low-key ways to connect. Go to a light-hearted movie, meet for a coffee and some people watching, or take a walk in a nearby park. The contact you get from others along with depression treatment can help bring you out of the dark and back into the light. Types of therapies to treat depression. First, psychotherapy. Psychotherapy, also known as talk therapy, is when a person speaks to a trained therapist to identify and learn to cope with the factors that contribute to their mental health conditions such as depression. Psychotherapy has been shown as an effective treatment in improving symptoms in people with depression and other psychiatric disorders. Second, cognitive behavioral therapy. In cognitive behavioral therapy (CBT), a therapist will work with you to uncover unhealthy patterns of thoughts and identify how they may be causing harmful behaviors, reactions, and beliefs about yourself. Your therapist might assign you homework where you practice replacing negative thoughts with more positive thoughts. Third, dialectical behavioral therapy (DBT). DBT is similar to CBT, but puts a specific emphasis on validation or accepting uncomfortable thoughts, feelings, and behaviors instead of fighting them. The theory is that by coming to terms with your harmful thoughts or emotions, you can accept that change is possible and make a recovery plan. Fourth, psychodynamic therapy. Psychodynamic therapy is a form of talk therapy that is designed to help you better understand and cope with your day to day life. Psychodynamic therapy is based on the idea that your present day reality is shaped by your unconscious childhood experiences. In this form of therapy, your therapist will help you reflect and examine your childhood experiences to help you understand and cope up with your life. Fifth, light therapy. Exposure to doses of white light can help regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorders, which is now called major depressive disorder with seasonal pattern. Talk with a healthy professional before using light therapy. Those with bipolar disorders can be at risk for mania using light therapy. Medication. Antidepressants can help treat moderate to severe depression. Several classes of antidepressants are available. First, selective serotonin reuptake inhibitors SSRIs, selective serotonin and neuroreuptake inhibitors SNRIs, atypical antidepressants, tricyclic antidepressants, monoxamine oxidase inhibitors MOIS. Each class acts on a different neurotransmitter or combination of neurotransmitters. A person should only take these medications as their doctor prescribes. Some drugs can take a while to have an impact. By stopping taking the drug, a person may not experience the benefits that it can offer. Some people stop taking medication after symptoms improve, but this can lead to a relapse or can cause loss to their health. A person should raise any concerns about antidepressants with a doctor, including any intention to stop taking the medication. Medication side effects include nausea, constipation, diarrhea, low blood sugar, weight loss or weight gain, a rash. The Food and Drug Administration FDA requires manufacturers to put a black box warning on an antidepressant bottle. The warning indicates that, among other risks, these medications may increase suicidal thoughts or actions in some children, teenagers, and young adults within the first few months of a treatment. While there is an increase in risk, the absolute risk remains low. Support Helpline. National hotlines provide free, confidential assistance from trained professionals 24 hours a day. They may benefit anyone with depression who wants or needs to talk about their feelings. Some of the support hotlines available include Samaritans. This non-profit organization offers emotional support to anyone who has feeling of depression or loneliness or who is considering suicide. Call or text 877-870-4673. Hope. The National Suicidal Prevention Lifeline. Call 1-800-273-8255. Talk. To speak with someone from this national network of local crisis centers. Lifeline Chat. This is an online chat service of the National Suicide Prevention Lifeline. Postpartum Support. International. Call 1-800-944-4773. This organization helps people struggling with postpartum depression as well as other mental health issues that are related to pregnancy, birth, and new parenthood. You can check out our website, peacepal.in, for detailed information on various topics through our alternate videos and daily blog posts. You can also check out our store for various courses, packages, appointments for therapy, and self-help books. Because together we can make a difference.